We now know 4 people died in Collin County healthcare facilities due to that untreatable fungus since January, but there's still a lot of unanswered questions. Tonight, health officials say they do not project a widespread outbreak in other hospitals. Thursday, the Centers for Disease Control and Prevention alerted the public about an untreatable superbug fungus present in what it called 2 Dallas area hospitals. The hospitals weren't named. It said 22 cases were reported since January when Texas first started reporting them. 2 deaths were reported by the CDC.
For the general public, it's not a major concern.
While it may not be a public health threat, it is a threat to sick and older patients in the hospitals and nursing homes. Late Friday, we learned about potentially more cases in North Texas hospitals. Collin County Health Services reported 9 cases since January and 4 deaths. Collin County also said the cases happened at 2 healthcare facilities there. What's left unclear whether the 2 Collin County hospitals and 2 hospitals reported by the CDC are the same or different.
Those hospitals know who they are, and believe me, they're taking those precautions to contain it and to keep it where it needs to be. And all the other hospitals now know that there's something in the area, and they're taking precautions.
The fungus can be spread from person to person, contact, or contaminated surfaces. Dr. Diana Cervantes was the state's chief epidemiologist during the Ebola response in 2014.
People can have this on their skin. They're not even aware of it. It's not even an issue for them, no big deal. But if they go to a healthcare setting, they get some kind of invasive procedure, then it can enter their body and cause serious outcomes.
While doctors have not found a treatment to kill the fungus, health officials say the superbug has been under surveillance for a while. It was first discovered in hospital settings in 2013. But the CDC said the North Texas cases may be the first evidence in the U.S. of human-to-human transmission. Floyd Wormley is the associate provost for research at TCU.
We have new emergent infectious diseases popping up all the time. So we have to remain vigilant. We need to continue to do research. We need to continue to do surveillance. We have new things that we may not ever heard of. Like monkeypox, like multi-drug resistant tuberculosis, different coronavirus. These things are continuing to be a problem, and people are constantly traveling all over the place. So we don't know what's next.
Again, there are a lot of unanswered questions tonight. We're not sure if the numbers that the CDC reported include the Collin County numbers that they reported today. We reached out to the state health department and local health departments in all of our big 4 counties, Denton, Collin, Tarrant, and Dallas, and we just received that information from Collin tonight. We have not heard back from the surrounding counties. And again, we don't know if there are 2 outbreaks in 2 hospital or healthcare facilities, or if there are 4, including these Collin County ones.